there's something that's always bothered me about chronic pain treatments. Doctors rarely, if ever, mention lifestyle changes.
You're exactly right, Tracy. And here's a shocking truth is that most patients never find out there's a natural way to heal chronic pain simply because their doctors just don't tell them.
That's right. If you're dealing with chronic pain, fatigue, and confusion from inconsistent medical advice, today's episode is specifically for you.
We're going to uncover what most doctors hide or simply don't know, and that is a natural lifestyle changes that actually relieve chronic pain without pills or invasive treatments.
Who doesn't like that, right?
Right, exactly. I mean, you gotta love that. So stick around because this could literally change your life like it has changed the life of so many other people. I'm Dr. Taj, and I'm a certified health coach. I'm a dentist, health professional, and I'm a strong advocate of holistic health practices.
And I'm Tracy. I'm a nutritarian health coach, passionate about lifestyle medicine.
Lifestyle medicine. Yes, not the pills.
Yes.
Yeah, so listen, it's so true. People are in pain. They wake up, they're hurting. They just want to dream about one day just feeling good, again, healthier, a little bit younger, and just not hurting all the time, right? Just free from that disease.
Yeah.
But the thing is, when they go see a doctor, the doctors rarely suggest any kind of lifestyle solutions.
I wonder why.
Well, it's sad though because it's one of those things that should always be a consideration: the natural way, or the pharmaceutical way, or the surgical way, and to offer a real, true, informed consent. That should be part of the tools in the toolbox that doctors should offer people.
Right.
Right, because there's not one true solution. There's always trade-offs.
Right.
And so when it comes to why doctors don't do it, I mean, the medical training that they receive, that I receive, I mean, it primarily focuses on like pharmaceuticals, surgical interventions or options, and not lifestyle medicine.
Wow. I wonder what's the thought behind that.
I mean, yeah, I mean, you start looking at the funding, you start looking at who influences the education, and the evidence, and that whole. I don't want to call it a racket, but I'm like, it's already out there, so I call it a racket. It's indoctrination, and it's self-fulfilling, I think, in a sense. And the only way you can explore yourself is by questioning everything, how I practice, and I question everything. I assume something to be false before it becomes true. And if it can handle the scrutiny, then it will become considered something you can actually offer.
Right.
And a lot of these medical interventions, surgical interventions, don't really stand up to the scrutiny involved.
Okay. It
All
doesn't
right.
make
So,
sense.
yeah.
It makes sense if you're looking at it to make money, right, as a business. But it doesn't make sense outside of that.
It's not truly all, I emphasize, all about health.
Right. There's different modalities, different ways, you're saying.
Yes. And then the problem with that is that when I talked about the informed consent, is that patients, the people who are receiving what they believe is healthcare, but really it's medical care, people, I mean, they often walk away just feeling that medication is the only solution. And that creates unnecessary dependency and side effects.
Yeah, a lot of people, when they go to the doctor for their regular checkups or they're having a problem, that's the first thing that's recommended is either you go for some type of invasive test that will stress you out, and then in the meanwhile, here's a medication to get you started.
Yeah. And the thing is to get you started on more medications down the line.
Yeah.
You know, I just had a patient I saw, she's been on anxiety medicine for 9 or 10 years, and she is not better from taking it. And in fact, I mean, she's had a more list of medications, but they changed her more medication. So it seems like the only thing that she can do is take more medicine, and she's frustrated and she's in pain and just feels overwhelmed. And it's sad. And this is why I do health coaching, because as a dentist, between my four walls, I can't do that.
Right.
You know, outside, I can help her. So that's the first problem. The second problem is the amount of pain, the chronic pain that impacts people's lives on a daily basis.
That's serious. That's serious because, I mean, we know people in our circles who are dealing with different health issues, and the pain that they feel is very limited and they cannot do certain things, right? They can barely even walk.
Yeah.
They could barely move their bodies because the medications have them so saddled down that they could barely do anything.
Or it's not even truly working.
Right. And they're uncomfortable. They're in pain still.
Yep.
right?
Can't sleep.
They can't sleep. Oh, that's a big one, right? They're
Yeah.
very tired. They can't do much. They can't do much with their children.
And emotionally speaking, when you think about all of that stuff that goes on in your life and you're in pain, you're not feeling good, and you're just almost an emotional wreck. You feel like the world is
You're
like
miserable.
losing. Yeah.
Yeah. Then you ever wonder some people why they're so mean at the stores or in your
Don't know.
circles, why they're
Yeah.
so mean, or you taking it personally?
Could be pain.
Maybe it could be that they're in pain.
Could be definitely in pain, or they have a lot of fear,
Yeah.
anxiety about their condition just getting worse.
Getting worse and there's no solution. And it's like they're spending all this money. They can't sleep.
Yeah.
They're miserable.
Yeah, so that's a huge problem with just this chronic pain. I think another problem is, you mentioned it, is just the frustrations with these tests, the diagnostics test. They try to, okay, well, I'm going to a doctor. I got to figure out what's going wrong. And many people want to go here and find out on what that label truly even is.
For some reason, that's what will make them feel better, that they know what it is.
The label.
So then they could start on some type of medication to think it will cure it.
Yeah, and once you label it and own it, then guess what? You own that label.
Yeah.
Versus saying, no, I don't care what it is, what's going on here. I'm gonna just fix this problem, and I'm gonna get to the root cause of it, because that's what I'm gonna do. And then you have that kind of,
Be your best doctor.
be your best doctor. Yeah, because I think these tests. I mean, there's some tests that are good and the right time, but when you have multiple inconclusive tests, and you go to see the doctor and the visits are just confusing, and then you get conflicting opinions. I mean, how do you not feel like you're just beyond frustrated?
Yeah, I have a friend that, she was sick, and while she was sick, she was told that certain fruits she was supposed to stay away from. Yet her doctor, her primary doctor, told her to eat those fruits to help her.
Yeah,
And it's just like, it's confusing.
Yeah.
What do you do?
yeah, exactly. All of this information all over the board, which is not really sound advice. And no wonder people are confused. People are overwhelmed. And then you start expressing kind of, hey, how about this, doctor? How about that is what I'm hearing. And they just kind of give it a shunned,
Yeah.
kind of
They don't take
appearance.
it seriously.
No, take it seriously. They just kind of dismiss it. And when you start feeling dismissed and unheard, I mean, you're like, my gosh, I mean, what's going on? Yeah. So it's those are the three main problems there that people have when they're definitely in chronic pain.
Yeah.
So those are the problems. So we talk about healing naturally. What are some natural lifestyle protocols or ways of life that doctors don't mention? I think one of the good ways to do it is like busting myths, though, right? Let's just bust them in the myth.
I mean, okay, so I have one.
Okay.
So lifestyle changes don't make a difference. That's a big myth out there.
Very big myth. The reason why you're sick is because of your lifestyle.
Okay.
And so if that's the reason why you are sick, how do you get healthy? By not doing what?
What you've been doing.
What you've been doing.
Yeah.
Yeah, and then there's plenty of evidence that shows this. Real good quality studies that from pain reduction, improved quality of life through just targeted lifestyle modifications. If you do that, you can begin to reverse or overcome the pain. So instead of dreaming one day that you may start feeling good again, guess what? You can actually feel amazing every single day.
So lifestyle changes, whether it's movement, sleep, diet, all those things.
Yes.
Right? Because some people think, well, lifestyle, I have to eat grass. And it's like, well,
Yeah, right. But that grass better than what you've been eating and doing. Yeah.
the fake food, the Franken food.
There are an overabundance of studies. And I think one study that kind of stood out is there's one from Harvard Medical School. And of the patients who adopted an anti-inflammatory diet and regular moderate activity, they see a dramatic improvement in their chronic pain symptoms.
Wow.
That's across the board. It just happens.
Who wouldn't want to do that? Because it's like, if you just have to eat healthy food, which guarantee you after a couple of weeks, your taste buds would change when you eat healthy food, right? And you start moving and sleeping. These are just natural things that are non-invasive, that won't give you any side effects,
Yep.
and you'll feel good.
No, there's a side effect.
Which is
Health.
good health.
All right, so that's one myth.
Okay.
Okay.
How's about another one? Let me
Yeah.
think. How about natural healing is slow and ineffective?
Yeah, slow, right. It happens pretty quick. I mean, we see it all the time with people we work with. I see it, in the offices, people I work with, our friends and family who keeps, and have some of the courage to just talk to you and do some stuff. Then there's some real life testimonials and even clinical research, okay, that just prove that rapid and long-term improvements, like you said, through nutritional interventions and holistic approaches, completely happen quickly and effectively.
Oh yeah, absolutely. If somebody who's diabetic, type 2, and they change their way to eat, cut out all the seed oils and eat fruits and vegetables, drink a lot of water, get sleep, movement, sunshine,
Yeah,
everything, you're going to see results in a couple of weeks.
quickly.
Yeah.
Look, because when we work with people, like 8-week program, they start feeling amazing in that long, and you have the
Yeah.
skills as we kind of ramp up. They have the skills to carry on further to take it to a whole nother level.
So now, if somebody who's very toxic, right, and who wants to make this change, and they make this change, and if their body's feeling some kind of way because their body is just like saying, "Wait a minute, what are you doing to me?" What do you tell them?
That is
The detox.
that's the part of the process, which letting your body know, or let your body's letting you know that, hey, there's something was completely wrong with me, and now I got to kind of reverse course, and it's like a withdrawal effect.
Okay, gotcha.
Like,
Oh
if you're on
wow,
drugs, like, whoa, I gotta give me more drugs.
it's the same thing.
The same thing. You got to
That's a
withdraw
good way to
from it.
look at it.
Yeah, and I tell you, but the thing is, it's the only true, safe, and effective lifestyle medicine there is. Only one.
I have to agree. Yeah.
100%.
Yeah.
And so like you said, the immediate relief methods, of course, nutrition, but it's like mindfulness, being in tune with your body, breath work, gentle yoga. Those all help with the reduction of those pain signals.
Yeah.
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 So
The
that myth
stresses.
right there about being, ineffective and slow, no, rapid and quick.
Okay. Okay.
Yeah.
Okay. Let me throw another one at you.
Okay.
Um, you need medications forever for chronic pain.
If you take medication and you believe that's the only medication, then that would be true. But that is entirely not true, because there's so many chronic pain people who are in chronic pain. They successfully taper off medications after incorporating lifestyle
Oh, Jesus.
medicine practices,
Right.
because you're no longer in pain. So why you got to take pain?
That's true.
Um, my goodness, I mean, you think about people who may have like kind of arthritis. Well, the reason why you have arthritis is probably due to some inflammatory type of issues. Now, if can you 100% reverse it? No, but you can get rid of that inflammation, get rid of that pain pathway, and now you've just got to manage it. And you do that for everything we just kind of talked about, through the diet, the sleep, the stress reduction, the physical activity. So yeah, so that is completely bogus. And there are so many, again, more evidence-based lifestyle protocols that out there. But I tell you what, let's let's dive. I'm gonna have you dive deep into some of the things that we help people with
Okay.
when it comes to, I guess, more detailed solutions around the lifestyle protocol or natural medicine, lifestyle medicine.
Yeah.
Starting with one you kept mentioning over and over again, you're big on it, which is that nutrition. It really heals.
It does. It does. So if you stick to the anti-inflammatory type of foods, the nutrient-rich foods, which are found in my favorite coin term from Dr. Furman is the G bombs,
Yeah.
right? Which is your greens, your beans, your onions, your mushrooms, your berries, and your nuts and seeds, right? You focus those on every day, get those into you every day. Those are nutrient dense foods. And even if you're not sure, obviously you can reach out to us and we will give you a list of foods,
Yeah.
right?
Comments below. Yeah.
Yeah. Then you have spices. People overlook spices such as turmeric and ginger,
Oh.
right? Cayenne. Those are great spices to incorporate, and it's you just put it in your food, and that's how you get it into your body. You don't have to pop a pill, right? But all of those that we were meant to eat, that was put on this earth for us to, that we were meant to eat, will strengthen our body and give you the nutrients you need.
Yeah, because I know you're a nutrientarian, and a health coach, and those are some of the principles that you learn. But overall, it just comes down to eating a sensible,
Yeah.
whole plant based food type of diet.
Right. And if you can, try to incorporate those, right? And if you can't, it's not going to kill you if you miss a few, but every day you have to be eating fruits and vegetables
Yeah.
and spices, plain and simple.
I have really never heard of an orange being bad for somebody. Truly, that's crazy to me. Unless it's sprayed with glyphosate, you know.
Yeah, then that is bad.
Yeah. Okay. Cool. So nutrition. How about like movement? That's another thing that people have to do for medicine.
Yeah, movement is medicine. I mean, that's a known fact. Everybody should know this. You have to move your body. I mean, the school system have PE for a reason, right? That's been in there for a reason. So kids need to move their bodies.
Now, do I have to go like run a mile, hard
No,
impact, or hit
no, you do
exercises?
something that's low impact, and it depends on where you are in your fitness journey. If you're at the beginning, then you do something that's simple, such as stretching, right? I think we have a video which you can link above where we talk about different exercises people can get started on,
Yeah.
which is
Okay.
just some mild stretching, mild yoga, go for a walk, right? And over time, as you get stronger, over a few weeks, you get stronger and you start to feel better and you have more energy, you incorporate more. But it's like this cycle. If you don't work out, you're not going to have energy. And if you don't have energy, you can't work out.
That's so true. Yeah. And like today, this morning, I did some yoga. And when I first got started, man, I was tired, like, whoa. And I'm doing all these stretches. I'm like, ah. But after I was done,
Felt good.
felt good. I didn't feel that for the rest of the day.
Yeah.
So, yeah,
And as we age, we need to move our bodies and stretch it, because then you ever see some older people sitting there and they could barely lift their arm, or
yeah,
they could barely move their legs.
yeah.
And I know part of it is that they're in pain, but they haven't really moved much. They don't stretch their bodies. They don't move it. Get outside, get fresh air, get the sunlight, and move your body.
Move it or lose
Walking.
it.
Yeah. And then if you're there's different ways to move your body besides walking. There's swimming, there's cycling,
Yeah,
there's biking,
non contact.
yeah,
And you
there's
can kind of
tennis.
escalate the intensity, the duration, the frequency
Right.
as you get stronger and stronger and
Stronger as you
stronger.
get stronger, and ultimately by the end, not just by the end, as you go further along, you want to incorporate some type of resistance training
Yeah, that's awesome.
to make your body stronger, and the body becomes strong.
Yep.
It can fight off anything.
So eat and move.
Yeah.
Okay, so after you eat and move, well, you got to restore and sleep.
That's right. That's where restoration happens when you're sleeping.
Yeah,
Deep sleep, right? It's critical for restoration, especially when you're in pain, your body to rebuild itself.
the rest. Yeah,
So you can,
it detoxes. It does the recuperation.
yeah,
Yeah, if you're sick, you sleep to use the energy to kind of get better.
better, right?
Yeah,
I mean, I would think people know this, but because when somebody has a cold or a flu, where are you? In that bed, sleeping,
Yeah.
right?
Yep,
Sleeping
yep,
it
yep.
off so your body could rebuild itself.
yeah. And in order to sleep well, there's some simple things that you can do is just make sure the room is completely dark.
Cool.
No screen time, cool, 68 degrees or so. Don't, yeah, you can start there and then slowly, kind of gradually, increase that skill set, if you will. Yeah. How about, that's three. How about like when you talk about stress reduction and mindfulness? Because stress has a major impact on the body.
Yes, it does. It does. And science-based stress reduction techniques such as, uh, I guess, taking a nice walk is one way, right? Meditation,
Huge.
mindfulness, that's another one.
Visioning the future or visioning exercises
Yeah.
about how you feel healthy, pain free, wake up out of bed and you're feeling good.
Good. Oh, that's a good one.
Yeah.
Yeah.
Mindfulness in a sense, right?
Mindfulness, yeah. Surrounding yourself with positive people too.
Laughter is a huge thing.
Yeah.
It releases a whole different chemical set versus being fearful or just worried about stuff.
Correct.
The
When
stress.
you spend time with friends and family that you love, not somebody who stresses you out, but you spend that time, you feel good about things, and it kind of uplifts you, not only mentally, emotionally, but physically.
Yeah, 100%. So those are great, simple solutions that you can do right now that are truly safe and effective. There's no side effects to do them, and versus the medicines. But here's the big thing, and here's why doctors just don't tell you about these holistic, natural lifestyle changes. It's because there's a big gap in medical training.
That's terrible.
Yeah, well, most medical schools offer very minimal training, like 1 or 2 hours, probably the 4 years. about lifestyle, nutrition, etc. And so they just don't know. They lack awareness of how effective these techniques that are based on evidence, again, are. And it's due to the institutional priorities. We talked about it, the pharmaceuticals, the grants, the surgeries. Know what's in it for them,
At the
not
end
the
of the
patient.
day, it's a business.
At the end of the day, it's about a business. It's a
It's
business.
about a business
Can't get
that
around
needs to
it.
generate revenue, and basically, it's generating revenue off of your health
Yeah, it is. And then you think about hospitals. How do hospitals make money?
by butts in the beds,
Butts in beds like a hotel, and they want you to keep coming back
for
over and over
surgeries,
again.
and for whatever
Checkups and more
procedures.
medicines,
Yeah,
yep, follow-ups and referrals, and you look at all that medical system how it exists today. There's an urgent care almost on every corner,
oh my gosh,
pharmacies on every single quarter,
yes,
more and more. These hospitals are all bought up all these different
private
smaller practices, and so
practices.
that's all internal referral based.
Yeah,
And I tell you, I have never seen anybody who I have rarely seen anybody walk into like an oncology department. It's a very, very emotional disease who didn't walk out really doing like any kind of chemotherapy in a sense, right?
yeah, everybody's set to do a surgery or some type of chemo radiation ASAP.
Yeah, it's ongoing treatments over and over and over again. That's why it's referred to as a medical meal. But if you can become self-empowering and take care of your own self, natural healing method, being your best doctor, you can escape that medical
Medical
meal.
mill, yeah, yeah. Why even wait to say, you know what, when something comes up, I will deal with it and make the changes then. No, you make the changes right now. If you're healthy,
Proactive.
you be proactive and you eat properly. Just like how they want you to be proactive and get your well checks, you be proactive and eat healthy so you don't need to go down that path.
That's it. Yeah, the only time you should go to the doctor is when you're truly, truly in need of them because maybe a broken leg, a car accident, some kind of accident, or if you're really, really, really indeed are sick. That's the only time I grew up I ever went to a doctor. I don't
Yes,
go to a
yeah.
doctor for a wellness visit. I'm well right now. I know. 'Cause I'm doing the things.
Yeah, yeah, yeah. Agreed.
Yeah. So empowerment, it does. It comes with information. Information is liberating, and it can free you from that medical meal and all the traditional healthcare approaches. But the thing is that information alone is not enough. If it was, Google, you do a little search on Google, and you'd be miraculously cured. So got to do more information, get the information, but act on the information because of act in a little bit of time and becomes a habit. That's how you get the results to reverse your condition, to stop dreaming that one day you'll be hurting. You'll be hoping that you're not hoping that you're younger and healthier. You'll actually will wake up every single day feeling amazing.
Who wouldn't want that?
It's awesome.
It takes a little work on your part, but so you have to see where you choose your heart. Do you want to do the work on the back end, run into the doctors, dealing with that type of pain, or
Yeah. Yeah.
cutting up your vegetables so you can eat those vegetables and be pain free?
That's it. So at the end of the day, as we wrap this up, it's you got to know that chronic pain can be healed naturally through lifestyle medicine.
You have to remain trapped in the cycle of pills, frustration, and pain.
Yeah. So if you're looking for more information, look, subscribe to the newsletter by joining the link below, and you'll be able to get more and more information, some action tips that are practical to reclaim your health naturally. Down below, share your experiences with chronic pain, frustrations with the medical system, your success stories through natural healing. We will love hearing from you.
Until next time, be well.
All right. Take care.